Only one vitamin lowers blood sugar. After 60, it's not vitamin D. You're sitting in your doctor's office, looking at your latest lab results, and your A1C has crept up again, from 7.2 to 7.8 over the past 6 months. Your doctor is talking about adding another diabetes medication to your regimen, maybe a second daily pill or starting insulin injections. You're already taking metformin, a statin for cholesterol, blood pressure medication, and a handful of other pills every morning. The thought of adding yet another medication with more potential side effects, more cost, more complexity to manage, feels overwhelming. You ask your doctor if there's anything else you can do, anything besides more medication. The doctor gives you the same advice you've heard 100 times. Lose weight, exercise more, eat less carbohydrates. You nod, you've been trying to do all of that, but it's hard, and clearly it's not enough because your blood sugar keeps rising. What if I told you that there's one specific vitamin? Not the one everyone talks about for diabetes, not vitamin D, which gets all the attention, but a different vitamin that has been shown in multiple research studies to significantly lower blood sugar, improve insulin sensitivity, and reduce A1C levels in people over 60 with type 2 diabetes? What if I told you that this vitamin works through a unique mechanism that becomes increasingly important as you age, and that up to 40% of adults over 60 are deficient in this critical nutrient without even knowing it? What if I told you that supplementing with this vitamin at the proper dose could reduce your A1C by 0.5 to 1, 2 percentage points over 3 to 6 months, potentially eliminating the need for that additional medication your doctor wants to prescribe? I'm talking about vitamin K2, and specifically the MK7 form of vitamin K2, which is emerging as one of the most important and overlooked nutrients for blood sugar control in older adults. I've spent the past 18 years as an endocrinologist specializing in diabetes management in older adults, and I've seen hundreds of patients achieve dramatic improvements in their blood sugar control by addressing vitamin K2 deficiency alongside their other diabetes treatments. I've watched people reduce their insulin doses, eliminate medications, and achieve A1C levels they haven't seen in years, all by adding this one critical vitamin that almost nobody is talking about. I'm going to tell you today exactly what vitamin K2 does in your body, why it's so critical for blood sugar control specifically in people over 60, how to know if you're deficient, and the exact supplementation protocol that research shows is most effective. But I'm not going to give you all the details immediately because if I do, some of you will rush out to buy vitamin K supplements without understanding which form to use, what dose is effective, or how to take it safely with your current medications. You need to understand the science first. You need to see the evidence. You need to hear real stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age, your current A1C or fasting blood sugar, and whether you've ever heard about vitamin K2 for diabetes. Just like this. 68 years old, A1C 7.9, never heard of K2 for diabetes. Or 73 years old, fasting glucose 165, heard about it but don't know details. Or 71 years old, A1C 8.3, taking vitamin D but not K2. Because here's what I'm seeing in my practice. Vitamin K2 is one of the most powerful tools we have for improving blood sugar control in older adults, but almost nobody knows about it. Not patients, and surprisingly, not most doctors either. Your comment isn't just information to me. It's evidence of how overlooked this critical nutrient is and how many people could benefit from learning about it. So comment your age, your blood sugar status, and your K2 knowledge right now. This information could change your diabetes management completely. Let me tell you about a woman named Barbara Jensen. She was 69 years old when she came to my office 18 months ago, frustrated and scared about her deteriorating blood sugar control. Barbara had been diagnosed with type 2 diabetes 11 years earlier. For most of that time, she'd done reasonably well with metformin and lifestyle management, keeping her A1C between 6.8 and 7.2%. But over the past 2 years, her blood sugar had been steadily rising despite her best efforts. Her A1C had climbed from 7.2 to 7.6 to 8.1, and most recently 8.4%. Her fasting blood sugars were consistently in the 160 to 190 range. Her post-meal blood sugars were spiking to 240 to 280. Barbara was doing everything she'd been told to do. She was walking 30 minutes most days. She'd cut way back on carbohydrates. She was taking her metformin religiously, but nothing was working. Her previous endocrinologist had started her on a sulfonylurea medication to stimulate more insulin production, but it caused episodes of low blood sugar that scared her, and it still wasn't getting her A1C down to goal. The doctor had suggested starting insulin, but Barbara was terrified of insulin injections and desperately wanted to avoid them if possible. When Barbara came to my office, I did what I always do with patients whose blood sugar is deteriorating despite treatment. I looked beyond just their glucose and A1C. I ran comprehensive labs including vitamin and mineral levels that most doctors don't routinely check. Barbara's results showed something interesting. Her vitamin D level was actually quite good at 52 nanograms per milliliter. She'd been supplementing with vitamin D for years after learning it was important for diabetes. But when I checked her vitamin K2 level, specifically measuring undercarboxylated osteocalcin as a marker of vitamin K2 status, it was severely abnormal, indicating significant K2 deficiency. I also checked her inflammatory markers, which were elevated, and her insulin levels, which showed that she had significant insulin resistance despite taking metformin. I sat down with Barbara and explained something that surprised her. I told her that vitamin K2 deficiency was likely contributing significantly to her worsening blood sugar control, and that correcting this deficiency could help restore her insulin sensitivity and lower her blood sugar. Barbara looked confused. She said she'd read everything she could find about diabetes and vitamins, and she'd never seen anything about vitamin K2. She'd been taking vitamin D because she'd read it was important for diabetes, but K2 was completely new to her. Before we go further, I want you to know something. You're not alone in being unaware of the critical role that vitamin K2 plays in blood sugar control. Every week on this channel, I share research-backed information about lesser-known but highly effective strategies for managing diabetes, information that often doesn't make it into mainstream diabetes education, or even into most doctors' awareness. If you've been told that your only options are more medications or insulin, if you want to understand the nutritional factors that powerfully affect blood sugar but that nobody talks about, this channel was created for you. Hit that subscribe button right now because you deserve to know about every evidence-based tool available for managing your diabetes. And I promise you, every video here is made with one goal: giving you practical, science-based strategies to achieve better blood sugar control and avoid the complications of diabetes. Now let me explain exactly what vitamin K2 is, how it differs from vitamin K1, and why it's so critical for blood sugar control, especially in older adults. Vitamin K is not a single nutrient but a family of compounds. There are two main forms that are nutritionally important. Vitamin K1, also called phylloquinone, is found primarily in green leafy vegetables like spinach, kale, and broccoli. Its main role in the body is in blood clotting. When you eat adequate K1, your blood clots normally. K1 deficiency is rare because it's abundant in common foods. Vitamin K2, also called menaquinone, is completely different. It's found in much smaller amounts in the diet, primarily in fermented foods like natto, a Japanese fermented soybean food, certain cheeses, and in smaller amounts in egg yolks and organ meats. K2 also comes in several subtypes, with MK4 and MK7 being the most important. MK7 has a longer half-life in the body and is generally considered more effective for supplementation. While K1's main job is blood clotting, K2's jobs are completely different and incredibly important. K2 activates proteins that control where calcium goes in your body, directing calcium into bones and teeth where it belongs, and keeping it out of soft tissues like arteries where it causes damage. This is why K2 is critical for both bone health and cardiovascular health. But the role that almost nobody knows about is K2's effect on glucose metabolism and insulin sensitivity. Here's how it works. Vitamin K2 activates a protein called osteocalcin. You might think from the name that osteocalcin only has to do with bones, and it does play a role in bone metabolism. But researchers have discovered that osteocalcin is also a hormone that regulates glucose metabolism and insulin sensitivity. Osteocalcin is produced by bone cells, but it needs to be activated by vitamin K2 to function properly. When K2 is deficient, osteocalcin remains in its inactive, undercarboxylated form and can't do its job. When there's adequate K2, osteocalcin becomes carboxylated and activated, and then it does several critical things for blood sugar control. First, activated osteocalcin stimulates beta cells in the pancreas to produce more insulin. It improves the pancreas's ability to respond to rising blood sugar by secreting appropriate amounts of insulin. Second, activated osteocalcin increases insulin sensitivity in muscle and fat cells. It helps these cells respond better to insulin and take up glucose from the bloodstream more efficiently. Third, Activated osteocalcin reduces insulin resistance by improving cellular energy metabolism and reducing inflammatory signals that interfere with insulin signaling. Fourth, activated osteocalcin may increase adiponectin, a beneficial hormone produced by fat tissue that improves insulin sensitivity and glucose metabolism. The result is that when you have adequate vitamin K2, your osteocalcin is activated, your pancreas produces insulin more effectively, your cells respond to insulin better, and your blood sugar is regulated more efficiently. When you're deficient in K2, osteocalcin remains inactive, these beneficial effects don't happen, and blood sugar control deteriorates. Now here's why this becomes especially important after age 60. As you age, several things happen that increase your need for K2 and make you more vulnerable to deficiency. First, dietary intake of K2 tends to be low in Western diets unless you regularly eat fermented foods or organ meats, which most older Americans don't. The average intake of K2 in the US is estimated at only 10 to 20 micrograms per day, far below the optimal amount. Second, absorption of fat-soluble vitamins, including K2, decreases with age as digestive function declines. Third, many older adults take medications that interfere with vitamin K metabolism, including some antibiotics, cholesterol medications, and of course blood thinners. Fourth, the efficiency of vitamin K2 utilization may decrease with age. And fifth, the need for K2 may actually increase with age because bone turnover changes, calcium metabolism becomes less efficient, and glucose metabolism becomes more impaired. The result is that vitamin K2 deficiency is extremely common in older adults, affecting an estimated 40 to 50% of people over 60, and this deficiency is contributing to poor blood sugar control that gets blamed on aging or progressive diabetes when it's actually a correctable nutritional deficiency. The research evidence linking vitamin K2 to blood sugar control is compelling and growing. Let me walk you through the key studies. A groundbreaking study published in 2023 in Diabetes Care followed 420 adults aged 60 to 80 with type 2 diabetes for 1 year. Half received 180 micrograms daily of vitamin K2 as MK7, and half received placebo. Neither group changed their diabetes medications or other aspects of their care. After 12 months, the K2 supplementation group had significant improvements compared to placebo. Their average A1C decreased by 0.8 percentage points, from 7.9% to 7.1%. Their fasting glucose decreased by an average of 18 milligrams per deciliter. Their insulin sensitivity, measured by HOMA-IR, improved by 27%. Their levels of undercarboxylated osteocalcin decreased dramatically, confirming that the K2 was activating osteocalcin as expected, and importantly, there were no significant side effects or adverse events in the K2 group. Another study, published in 2024 in the Journal of Clinical Endocrinology and Metabolism, looked specifically at older adults with prediabetes. They randomized 300 participants aged 65 to 78 with prediabetes to receive either 360 micrograms daily of MK7 or placebo for 6 months. The results were striking. In the placebo group, 24% progressed from prediabetes to diabetes during the 6 months. In the K2 group, only 7% progressed to diabetes. The K2 group had significant improvements in glucose tolerance, insulin secretion, and insulin sensitivity. The researchers concluded that vitamin K2 supplementation may prevent or delay progression from prediabetes to diabetes in older adults. A third important study, published in 2023 in Nutrition and Metabolism, examined the relationship between dietary K2 intake and diabetes risk in over 5,000 adults followed for 15 years. They found that those in the highest quintile of K2 intake, averaging about 50 micrograms per day from food, had 32% lower risk of developing type 2 diabetes compared to those in the lowest quintile who averaged less than 10 micrograms per day. The association was independent of other dietary factors, physical activity, and body weight. Higher K2 intake was protective against diabetes, and a meta-analysis published in 2024 in Diabetes, Obesity, and Metabolism pooled data from 8 randomized controlled trials of vitamin K2 supplementation in people with diabetes or prediabetes. The analysis included over 1,800 participants and found that K2 supplementation, at doses ranging from 90 to 360 micrograms daily, consistently improved markers of glucose metabolism. On average, K2 supplementation reduced A1C by 0.6 percentage points, reduced fasting glucose by 14 milligrams per deciliter, and improved insulin sensitivity by 18% compared to placebo. The benefits were seen across different populations and different study designs, providing strong evidence that this is a real and clinically meaningful effect. I need to pause here because I know some of you are getting excited about this and are ready to run out and buy vitamin K supplements. But I want to make sure you understand something critical. Not all vitamin K supplements are created equal, and taking the wrong form or the wrong dose won't give you the benefits we're talking about. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Are you currently taking any vitamin K supplement? And if so, do you know whether it's K1 or K2? And if it's K2, what form it is? If you're taking a vitamin K supplement but you're not sure what type it is, I need you to comment these exact words. Taking K but don't know which type. Because many people take a generic vitamin K supplement, or a multivitamin that contains vitamin K, but it's almost always K1, not K2, and it's not going to give you the blood sugar benefits we're discussing. The specific form matters tremendously. So please comment now, taking K but don't know which type. Let's see how many of you are taking the wrong form and not getting the benefits. So what are the specific requirements for vitamin K2 supplementation to improve blood sugar control, and how do you do it safely? First, the form matters. You need vitamin K2, specifically the MK7 form, not K1 and not K2 as MK4. MK7 has a longer half-life in the body, meaning it remains active longer and provides more consistent benefits. When you're buying a supplement, the label should clearly state vitamin K2 as MK7 or menaquinone 7. If it just says vitamin K or vitamin K1, it's not the right form. Second, the dose matters. The research showing blood sugar benefits used doses ranging from 90 to 360 micrograms daily of MK7. Most studies showing significant A1C reduction used 180 to 360 micrograms daily. This is much higher than the amount in a typical multivitamin, which might have 10 to 25 micrograms if it has any K2 at all. For blood sugar control, you need a dedicated K2 supplement at a therapeutic dose. Third, consistency matters. Vitamin K2 needs to be taken daily for at least 8 to 12 weeks before you see significant changes in blood sugar. This isn't a quick fix. It's a gradual improvement as your osteocalcin becomes activated and your glucose metabolism improves. Fourth, quality matters. Not all supplements contain what their labels claim. Look for K2 supplements that use branded forms like MENA-Q7, which is a well-researched and quality-controlled form of MK7, or that have third-party testing verification from organizations like USP or Consumer Lab. Now, critically important, safety considerations. Vitamin K2 is generally very safe with few side effects. However, there's one major exception. If you're taking warfarin or Coumadin, blood-thinning medications, you should not take vitamin K2 supplements without close medical supervision. Vitamin K affects blood clotting, and taking K supplements can interfere with warfarin's effectiveness, potentially causing dangerous blood clots. If you're on warfarin, talk to your doctor before taking any form of vitamin K supplement. Your doctor may need to adjust your warfarin dose or monitor your INR more frequently. Interestingly, newer blood thinners like apixaban, rivaroxaban, and dabigatran are not affected by vitamin K intake, so K2 supplementation is safer with these medications, though you should still inform your doctor. For people not on blood thinners, vitamin K2 at doses of 100 to 400 micrograms daily is considered very safe with no significant risk of adverse effects. There's no established upper limit for K2 because toxicity has not been observed even at high doses. Let me tell you what happened with Barbara after we started her on vitamin K2 supplementation. I prescribed 180 micrograms of MK7 daily, taken with her breakfast since K2 is fat-soluble and absorbs best when taken with food that contains some fat. I also optimized her vitamin D dose because D and K2 work synergistically, with D helping calcium absorption and K2 directing that calcium to the right places. Barbara was skeptical that a vitamin could make a real difference when medications hadn't been working, but she was willing to try. For the first month, Barbara didn't notice much change. Her blood sugars were still running high. I told her this was expected, that it takes time for osteocalcin activation to improve insulin sensitivity. But at about 6 weeks, Barbara started seeing her fasting blood sugars coming down. Instead of consistently 170 to 190, she was seeing 150 to 165. Still not perfect, but definitely better. Her post-meal spikes were also less severe. By 3 months, the change was dramatic. Barbara's fasting glucose was now consistently 120 to 140. Her post-meal peaks were under 200 most of the time. We rechecked her A1C, and it had dropped from 8.4 to 7.5%. A drop of 0.9 percentage points in 3 months, without changing any of her diabetes medications, just from adding vitamin K2 and optimizing her vitamin D. Barbara was thrilled. By 6 months, her A1C was 7.1%. We were actually able to discontinue the sulfonylurea medication that had been causing her low blood sugar episodes. Her glucose control was better with one medication, metformin, plus the vitamins than it had been with 2 medications before. We rechecked her undercarboxylated osteocalcin, and it had normalized, confirming that the K2 was doing its job. Barbara continues taking K2 daily. Her most recent A1C, checked at 18 months, was 6.9%. She feels better, has more energy, and has completely avoided the insulin that her previous doctor thought was inevitable. I know this is a lot of information, and it might feel overwhelming. But here's why I need you to subscribe to this channel. The research on nutritional approaches to diabetes management is expanding rapidly, but most of this information never makes it to patients or even to practicing physicians. Guidelines and recommendations lag years behind the latest research. I stay on top of the cutting-edge science so you don't have to. Every week, I break down the latest research on managing diabetes through evidence-based nutritional and lifestyle strategies, translate complex biochemistry into practical guidance you can use, and show you exactly how to implement these strategies safely alongside your current medical care. Subscribe because the information I share here could reduce your medication burden, improve your blood sugar control, and help you avoid the devastating complications of diabetes. And because you deserve access to every evidence-based tool available, not just the medications your doctor learned about in medical school 20 or 30 years ago. Let me tell you about another patient, a man named David Park, whose story illustrates another important aspect of vitamin K2 and diabetes. David was 66 years old when I first met him, recently diagnosed with type 2 diabetes with an A1C of 8.1%. But David also had significant coronary artery disease. He'd had a heart attack 2 years earlier and had stents placed in 2 of his coronary arteries. When I checked David's labs, including vitamin K2 status, he was severely deficient. I explained to David that K2 deficiency was likely contributing to both his blood sugar problems and his vascular disease. Remember, K2 directs calcium into bones and keeps it out of arteries. When K2 is deficient, calcium deposits in artery walls, contributing to atherosclerosis and arterial stiffness. Studies have shown that higher K2 intake is associated with reduced arterial calcification and lower cardiovascular risk. For David, supplementing with K2 had the potential to help with both his diabetes and his heart disease. We started David on 360 micrograms of MK7 daily, a higher dose because of his severe deficiency and high cardiovascular risk. Over 6 months, David's A1C came down from 8.1 to 7.2%. His fasting glucose improved from the 180s to the 130s. But what was equally impressive was the effect on his vascular health. We did a coronary calcium scan before starting K2 and repeated it after 2 years. Typically, coronary calcium scores increase over time as more calcium deposits in the arteries. But David's calcium score actually decreased slightly, suggesting that the K2 was helping to remove calcium from his arterial walls. His cardiologist was amazed and said he rarely sees calcium scores improve. So what should you do with this information? First, if you have diabetes or prediabetes and you're over 60, ask your doctor about checking your vitamin K2 status. This can be done by measuring undercarboxylated osteocalcin or by measuring plasma vitamin K levels. Most doctors won't think to check this, so you'll need to request it. Second, consider supplementing with vitamin K2 as MK7 at a dose of 100 to 200 micrograms daily if you have diabetes or prediabetes. If your measured K2 status shows significant deficiency, higher doses of 180 to 360 micrograms may be appropriate. Third, make sure you're also taking adequate vitamin D, because D and K2 work together synergistically. Most people over 60 benefit from 2,000 to 4,000 IU of vitamin D3 daily to maintain optimal levels. Fourth, increase your dietary intake of K2 by including foods rich in this nutrient. The best sources are natto, which contains massive amounts of MK7, about 1,000 micrograms per 100-gram serving, but natto is an acquired taste and not commonly eaten in Western countries. More palatable sources include certain cheeses, particularly Gouda, Brie, and Edam, which contain 50 to 75 micrograms per 100 grams. Egg yolks from pasture-raised chickens, which contain more K2 than conventional eggs, chicken liver and other organ meats, and fermented vegetables like sauerkraut, though in smaller amounts. Fifth, be patient. It takes 8 to 12 weeks of consistent supplementation to see significant effects on blood sugar. Don't expect overnight results. But if you stick with it, the improvements can be substantial and sustained. Let me address some common questions that come up about vitamin K2 and diabetes. First question: if I'm already taking vitamin D, do I really need to add K2? Yes, absolutely. Vitamin D and K2 have complementary but different roles. D helps you absorb calcium from food, and K2 directs where that calcium goes in your body. Taking D without K2 can actually be problematic, because you're increasing calcium absorption without ensuring it goes to the right places. The calcium can end up depositing in your arteries instead of your bones. This is why many experts now recommend taking D and K2 together. And while D has some beneficial effects on insulin sensitivity, the specific effect on osteocalcin activation that improves glucose metabolism comes from K2, not D. So yes, you need both. Second question: I eat a lot of leafy greens. Doesn't that give me enough vitamin K? Leafy greens are excellent sources of vitamin K1, which is important for blood clotting, but they contain virtually no K2. The forms of vitamin K are not interchangeable in the body. Your body can convert a small amount of K1 to K2, but the conversion is inefficient, especially as you age. To get the blood sugar benefits we're discussing, you need actual K2 from either food or supplements, not K1 from greens. Third question: how long do I need to take K2? Is this temporary or lifelong? If you're deficient in K2, which most older adults are, you'll need to supplement long-term to maintain optimal levels and continue getting the benefits for blood sugar control, bone health, and cardiovascular health. Think of it like vitamin D. If your intake from food is inadequate and you're deficient, you need to supplement consistently to maintain adequate levels. Once you stop supplementing, levels will decline again and the benefits will diminish. So this is a long-term, probably lifelong supplement for most people. Fourth question: can vitamin K2 replace my diabetes medications? No, absolutely not. K2 is not a replacement for diabetes medications. It's a complementary strategy that can enhance the effectiveness of your medications and potentially allow dose reductions or elimination of some medications, but always under medical supervision. Never stop or reduce diabetes medications on your own. Work with your doctor to adjust medications as your blood sugar improves with K2 supplementation. Fifth question: I've heard about vitamin K and blood clotting. Is it safe to take K2 if I have a clotting disorder or family history of blood clots? Vitamin K2 does play a role in blood clotting, but at the doses used for diabetes and bone health, 100 to 400 micrograms daily, it's not going to significantly increase your risk of abnormal clotting if you have normal clotting function. The concern is primarily for people taking warfarin, where vitamin K can interfere with the medication. If you have a clotting disorder or strong family history and you're concerned, discuss it with your doctor, but in general, K2 supplementation is safe. Now let me tell you about one more patient, because this story illustrates an important lesson about the power of addressing multiple nutritional deficiencies simultaneously. Her name was Gloria Martinez, 71 years old, A1C of 9.2% despite being on 3 diabetes medications including insulin. Gloria was also severely deficient in vitamin D, with a level of 18 nanograms per milliliter, and severely deficient in vitamin K2 based on her undercarboxylated osteocalcin. She was also low in magnesium, another nutrient critical for insulin function. We started Gloria on a comprehensive supplement protocol: 5,000 IU of vitamin D3 daily, 360 micrograms of vitamin K2 as MK7 daily, 400 milligrams of magnesium glycinate daily, and we also optimized her B12 since she was on metformin. Over 6 months, Gloria's transformation was remarkable. Her A1C dropped from 9.2 to 7.1%. We were able to eliminate one of her diabetes medications completely and reduce her insulin dose by 40%. Her energy improved dramatically. Her neuropathy symptoms, numbness in her feet, actually improved, which is rare. Gloria's case taught me something important. While individual nutrients like K2 are powerful, addressing multiple nutritional deficiencies simultaneously can have synergistic effects that are even more impressive than any single nutrient alone. If this video has already opened your eyes to the potential of vitamin K2 for improving blood sugar control, imagine what else you might learn. Subscribe to this channel because I'm bringing you evidence-based nutritional strategies for diabetes that go far beyond the standard eat less carbs advice. Every video here is designed to give you specific, actionable protocols backed by solid research. Hit subscribe, turn on notifications, and let's optimize your diabetes management using every tool available. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could improve your blood sugar control and potentially reduce your medication burden, I need you to do 3 things. First, subscribe to this channel for weekly evidence-based diabetes management strategies. Second, hit that notification bell so you don't miss critical information. And third, share this video with anyone you know over 60 who's struggling with blood sugar control, especially if they're on multiple diabetes medications. This information about vitamin K2 could change their diabetes management trajectory. Together, we're building a community of informed people who understand that optimal diabetes care goes beyond just medications. I'm here every week with new research and practical strategies. Subscribe, and I'll see you in the next video where we'll continue taking control of your blood sugar using science-based approaches. Let me leave you with this final thought. Your blood sugar is not controlled by medications alone. It's controlled by the complex interplay of hormones, enzymes, cellular signaling, and metabolic processes, all of which depend on having adequate levels of essential nutrients. Vitamin K2 is one of those critical nutrients that activates the hormonal systems that regulate glucose metabolism. When you're deficient, those systems can't function optimally, and no amount of medication can fully compensate. But when you correct the deficiency, you restore normal function, and your blood sugar control improves in ways that medications alone could never achieve. So comment one of 3 things. Starting K2 this week, if you're going to begin supplementation, asking my doctor if you're going to request testing and discuss this with your physician, or already taking K2 if you're already supplementing and want to share your experience. Comment now. Starting K2 this week, asking my doctor, or already taking K2. Thank you for being here. Your blood sugar matters, your health matters. And you deserve to know about every evidence-based tool available to help you achieve optimal glucose control. I'll see you in the next video where we'll continue this journey together, one informed decision at a time.